आई विल नॉट से मेमोरी, हमारे दिमाग के कई काम हैं। आज उस काम का एक सेक्शन के बारे में चर्चा हो रही है। एक्सपर्ट हमको बताएंगे कि कैसे वो इस सेक्शन के बारे में बात करते हैं जो कि मेमोरी से अटैच है। So, जागृति, कैन वी हैव द पोल प्लीज? अब ध्यान से, अब सब लोग ध्यान से सवाल पढ़िए ताकि हमारे एक्सपर्ट को पता लगे कि आपका कितना नॉलेज है। जागृति, कैन यू प्लीज पुट अप द पोल? आई एम स्टॉपिंग टू शेयर। प्लीज पुट अप द पोल, जागृति। जागृति।
Sir, we are having some difficulty in running the poll.
Okay, doesn't matter. Forget it. Now, please mute everybody. Okay, मैं सिर्फ इतना पूछ रहा हूँ, वो पोल पे मुश्किल हो रही है। एक सवाल पूछूंगा, आप सबको कभी ये लगा खुद को कि आपको याददाश्त में कोई तकलीफ है? कितनों को लगा? कैन यू पुट अप योर हैंड्स? काफियों को लगा। कितनों को ये लगा, कितनों को कहा गया किसी और से कि आपको याद के भाई लगता आपकी मेमोरी कमजोर है? एक तो है खुद को महसूस हुआ।
You are muted, sir.
How many people have been told that लगता आपको मेमोरी लॉस है? Is that so? Okay. Now, we couldn't carry the poll, but a number of people have opted. I will now ask one of our guests, very regular members, Coordinator Bedi. He requested him to speak on behalf of the elders. कि elders अपने बारे में या memory के बारे में कितनी जानकारी रखते हैं, so that our expert knows how much to speak about. Coordinator Bedi, yes, you are here. I will.
Good afternoon to everybody. As usual, today we are again facing a very, very interesting subject by an interesting our friend Dr. GREWAL, whom I knew for the last 40 years. He looks as fresh as I saw him 40 years back, and with the same radiant smiles always on his face. Yes, your topic is not only informative, it has got a lot of brain teaser also in it. When I saw the topic, it said dementia prevention and management. I was just wondering whether the two words are synonymous or not. Well, dementia, I feel, is the property of brain, which is a hardware, which is a material subject. And a material subject has to age. It has to decrease in its property as the time passes. And how can you really stop it aging and prevent it? Management, yes, I fully understand. Management of this brain has to be there. In fact, to be very frank with you, I tell you, I think dementia is a God-gifted property which is embedded in our brain. Because if you really don't forget certain past things, at the age of 86, if I remember all the good and bad events, I think I will not be able to live in the present. It will be difficult for me, as the leader always says, forget about the past. How do I forget if I remember everything? Dementia is a good property. And I'm really sharing with you a very interesting thing, that whenever I forget at this age a few articles or few words a few faces, and I recollect after a couple of minutes or a couple of seconds. I enjoy the moment. I try to find out how this thing happened, how it happened to me, and it is not at all a difficult, torture to my mind, and I enjoy it. In fact, I feel it is a God-gifted thing. If And probably this software works so beautifully well that when you age more and more, you are more prone to the attack and disturbances of the past if you don't forget them.
Very
And it
right.
automatically works. Number one. Number two, as I have told you, I enjoy every moment when I forget a thing and recall it. अगर आप मुझे थोड़ा सा 30 सेकेंड्स और दें तो मैं आपको एक इंटरेस्टिंग आइटम इंस्टेंस अपने ऊपर बताऊंगा, जिसका इसका आउटपुट ये है कि इट इज नॉट ओनली यू एंजॉय, इट इज यू व्हेन यू आर इन डीप दुख की घड़ियों में हो अगर आप हैं तो यू प्रॉब्ली स्माइल इन दोज मोमेंट्स आल्सो। वो इंस्टेंस इस तरह से है जिसमें डॉक्टर ग्रेवाल साहब एक बड़े किरदार हैं, इनको पता भी नहीं है, इनको मैंने आज तक बताया भी नहीं है, ये पता नहीं मेरी बात सुन रहे हैं कि नहीं सुन रहे हैं कहीं मसरूफ लग रहे हैं। ये कोरोना के पीरियड में आई सफर्ड ए लॉट। अल्टीमेटली आई वाज एडमिटेड इन द बेस हॉस्पिटल फॉर अबाउट 25 days। अब जब एंड पीरियड आता है तो आप ईश्वर को याद करते हैं, और जब आप बहुत ज्यादा बीमार होते हैं तो आपका सबसे पहले जो होता है सामने आपका डॉक्टर होता है। और मुझे जो उस वक्त जिसकी याद आई वो थे डॉक्टर ग्रेवाल। अब मेरे पास कोई और चारा नहीं था, मेरे पास एक मोबाइल पड़ा हुआ था। मैंने उनको बोला कि भाई मेरा मोबाइल दे दो जरा मुझे। मैंने मोबाइल उठाया, उसमें भूल ये हो गई, डायमेंशिया था या क्या था मुझे नहीं मालूम, मैंने ग्रेवाल साहब का नाम पढ़ा और एक बटन दबा दिया, और उस बटन दबाते ही मुझे ऐसा लगा कि मैंने ब्रह्मा जी की नाभि में हाथ रख दिया और बटन वो दब गया है। और उधर से आवाज आई, और उधर से जब आवाज आई तो दैट वाज ए फीमेल वॉइस। अब मैंने कहा यार ब्रह्मा जी तो नहीं हो सकते, कहीं लक्ष्मी जी का बटन तो नहीं दब गया। तो फिर उधर से क्या हुआ कि उसकी आवाज आते ही एक लफ्ज उन्होंने बोले, और बेदी तनु की हो गया है खरीद। मैंने उनको पहले बोला, मैंने कहा डॉक्टर साहब को जल्दी से बुलाओ, उनको मोबाइल दे दो अपना जो है। मैंने समझा उनके घर से किसी फीमेल मेंबर ने उठाया होगा तो डॉक्टर साहब कहीं बिजी होंगे। तो डॉक्टर साहब तो लाइन पे नहीं आए, तो उन्हीं की आवाज फीमेल वॉइस आई, और बेदी तनु की हो गया है खरीद है, डॉक्टर किसी क्यों बुला रहे हैं। तो अब मैंने रियलाइज किया कि वो जब मैंने अपना फोन बुक देखा तो ग्रेवाल को कॉमन नेम है, तो डॉक्टर ग्रेवाल को नंबर कैलाश कॉलोनी में नहीं लगा था, वो लग गया था विंग कमांडर ग्रेवाल को जो कनाडा में बैठे हुए हैं। और वो विंग कमांडर ग्रेवाल भी हॉस्पिटल में एडमिटेड थे कनाडा में, और उनकी वाइफ ने घर पे फोन उठा लिया। अब उसके बाद में क्या पैनिक हुआ, क्या मेरे रिश्तेदारों में पैनिक हुआ, कितने फोन आए हुए, वो मैं ज्यादा डिस्क्राइब करूंगा तो मेरे ख्याल में सारा आपका टाइम खत्म हो जाएगा। भाई आई एंजॉयड द मोमेंट। उस दुख की ग्रेव मोमेंट में भी देयर वाज अ स्माइल ऑन माय फेस व्हिच कुड बी सीन बाय माय अटेंडेंट हु वाज माय सन। कहने लगा आप तो स्माइल कर रहे हैं। मैंने कहा यस, समथिंग हैज हैपेंड। थैंक यू।
Thank you. Thank you, Bedi Saab. Thank you, Bedi Saab. Thank you. That was a first-hand talk about his experience of having sudden a feeling of memory loss. I think we'll now invite our expert, Dr. Charu Gaba. Let me locate her. Dr. Charu, could you please?
Yes, sir, I'm here. Shall I share the screen?
Just a minute. Let me ping you first. कहाँ पे है आपका? Just a
I
minute.
am CLA, sir.
Okay. Yeah. I'll just. Okay. Right now you're there. I'll remove myself from here. Yes. So welcome, Dr. Charu. Thank you so much for sparing your time, and it's a pleasure to have you over, despite your heavy OPD time. So you may start your presentation, and whenever you want to start sharing, you will do it, please. So this is आप इंग्लिश हिंदी दोनों में प्लीज कन्वर्स करिए, हमारे
Yes.
काफी लोग हिंदी में चाहेंगे.
Thank you.
Punjabi, if you want any language. So you want to share, you can share your slides now,
Okay.
and you can start it.
I've shared, sir. Is it visible?
अभी नहीं आया.
Acha.
Arrow के press करिए and then yes.
I have shared it, sir. Is it visible? Sir, can you hear me?
Yes, I can hear you, please.
But is the screen visible?
नहीं अभी नहीं आया. When you press the share button, do you see your presentation? आपने खोल रखा होगा ना presentation को.
हाँ जी. Please just
आप
help.
देखिए, can you see your presentation or not? Come on, relax. Yeah, it's starting. Starting to come. Yes, it's starting. इसको full screen करो. You're good to go, please.
Okay, right. Start. Good evening. Thank you for inviting me to give this talk. I was under the impression that it was for physicians, but I will try and put it in normal language. Dementia is an illness of the cognition. Mostly there is memory impairment, but there can be other issues like difficulty in learning new tasks, difficulty in making judgments, and a general impairment of the mental faculties. So when one comes across somebody who complains of memory impairment, very often it may be a subjective thing, a feeling that one is forgetting. But one has to assess and see whether there is a significant memory loss and whether it needs some treatment. So there are two types of dementias. One is the degenerative type, which means that there is gradual shrinkage of the brain and the mental faculties very slowly go down. And this is the most common type of degenerative dementia is Alzheimer's, which everybody may have heard of. But there are other types which are called non-degenerative dementias, which are more treatable. Alzheimer's and the slowly progressive dementias, which happen because of shrinkage of brain, don't have very effective treatment for them. But the non-degenerative dementias are more amenable to treatment. So when somebody comes across someone with memory loss, you always have to look for simple things like certain nutritional deficiencies. A very common cause is vitamin deficiency, which tends to happen in our country very often because many people are vegetarian and they are more prone to have especially this deficiency of vitamin B12. Then thyroid diseases can cause, is also a common cause of memory loss. And then various other organs, if they're affected, it can lead to some degree of memory problems. There's also a whole lot of drugs or medicines which can cause memory impairment. So any medicine which acts through the brain and causes some amount of sedation or sleepiness can also cause memory issues. So it's very important to look at the list of medicines and see if there's anything that can be stopped, which is not essential. Strokes are common causes, but here the memory loss will happen all of a sudden. Sometimes there can be bleeding within the brain, especially in older people, there can be bleeding on the surface of the brain. And that does not happen suddenly like in a stroke. That will be a more gradual memory impairment. So again, that is a common cause of memory loss. That's something to be looked for. Then various tumors and other uncommon diseases, infections, especially of the brain, but also infections of the rest of the body can cause some degree of memory impairment. So these are the things that when you approach, when you see your doctor, these are the things that they'll be looking for, because these are all conditions which can be easily treated. So very important is that any person with a memory issue would need some simple tests like checking their vitamin levels or their thyroid status. But most of them will also need an MRI of the brain. And most of these conditions which are listed here will get picked up on the MRI. Some people may also need a lumbar puncture or a spinal tap, which is when a brain infection is being suspected. So I will now move on to the degenerative dementias, which are the general dementias that we talk about, the slowly progressive memory loss that happens over time. So there is some amount of memory impairment which happens with normal aging. As one ages, there are certain things, your reservoir of knowledge will increase, your vocabulary will increase. There is general wisdom that comes with age, but there will be certain things that you notice which are not as good as in a younger person. For example, the ability to learn new tasks. Or, for example, if you notice, young people are very good with gadgets, whereas older people have difficulty picking up those things, often, not everybody. So, those are the things that get affected with normal aging. But if it starts to become a little more than normal, where people start noticing that you're having issues. That is the stage of mild cognitive impairment. Now, this could be predominantly in the memory, which is called amnestic. Amnestic comes from amnesia, which is memory loss. Or it can be non-amnestic, meaning that it's not so much the memory that is affected, it's more of learning how to do learning new tasks which are affected. And once the activity of daily living, once the activities of daily living are affected, then that is the stage at which one is labeled as dementia. Activities of daily living would be things like the ability to look after your own hygiene, bathing, dressing, toilet needs, feeding yourself. So when the cognitive impairment progresses, all these activities also become difficult and people start needing help. And that is when you label it dementia. But the mild cognitive impairment stage is the stage where perhaps one can intervene and do things which could, possibly prevent the person from going into a dementia stage. Dementia, unfortunately, gradually progresses over time. And they may come in, not in all people, but in many people, it may become severe and they may become totally dependent on their caregivers. But nobody dies of dementia as such. The risk to life is more from things like infections, because when a person is bedbound and dependent, they become more prone to such complications like infections. And those are the things that can cause a risk to life. So if you see this slide, you will notice that Asia has a high prevalence of dementia. And that could also be because the most populous countries are in Asia, and ours happens to be one of them. And worldwide, it was estimated that about 57 million people all over the world suffer from dementia. And majority of them live in low and middle income countries. In India, the prevalence is thought to be about 8.8 million when last checked 2-3 years ago. And here they've also provided estimates, because as the lifespan increases, since dementia is a disease of old age, it's but natural that the prevalence of dementia will also increase as lifespans increase. The average lifespan all over the world is now about 73 years. And why we didn't hear so much about dementia earlier was because even till the early 1900s, the average lifespan was only about 30 years. So as medical science has improved and lifespans have increased so much, that is why we are seeing much more dementia now. And it's projected to go up even further by the year 2050. So the degenerative dementias, which happen because of shrinkage of brain, there are various types, but the commonest, as you see here, is Alzheimer's, which is the one I think most people would have heard of. And the second most common is vascular dementia, which is basically the dementia which is associated with strokes or with low circulation in the brain. The other types are all uncommon. Out of all these, the only one that has a specific treatment is Alzheimer's disease. And of course, stroke-related dementia would have treatments such as blood thinners and cholesterol medicines, etc., to prevent further stroke so that the brain, the nerve cells are not lost further. But the other types don't have any specific treatment. Luckily, they are much less common than Alzheimer's or stroke-related dementia. So this one is more for the doctors. When one is a patient with cognitive impairment comes to the doctor, they need to ask the symptoms, of course, and very important, they need to ask how fast the memory loss is progressing, because that gives you an indication. If it's a very slow rate of progression, it's likely to be Alzheimer's or one of the degenerative dementias. Whereas if it is relatively rapid, then you need to do a number of tests to try and find out more treatable causes, like say, for example, strokes or brain infections. One must ask for a history of head injury because that is an important risk factor. Age, as I mentioned, is one of the most important risk factors. One doesn't come across dementia that much in younger people unless there's a hereditary predisposition, which is also quite rare. The level of education matters because people who are less educated are more prone, in fact, to develop cognitive impairment as they get older. One must ask for risk factors which predispose to stroke because repeated strokes can reduce the nerve cells in the brain and cause memory issues. Then very important is the list of medicines, especially older people often have sleep issues and are very often on sedatives, which may be a simple reason for the memory loss. And just trying to wean off the sedatives may make a difference. Another important cause is depression. Depression by itself can also cause issues with the memory. And just treating the depression will make a difference. And finally, one must ask if the person is able to perform activities of daily living. After the history taking, the person will have to be examined in detail, and this includes a neurological examination. In Alzheimer's, the general neurological examination is normal. Apart from the cognition, the other things are all normal. There are certain dementias which can be associated with Parkinsonism. So those will have to be looked for. And if a person has had a stroke in the past, then one would think of this vascular dementia. And before doing anything else, one must check the vitamin level, especially B12 level and thyroid function, and also check sodium level because low sodium is a common cause of memory loss.
Sorry, Dr. Gaba, is there a cutoff point for B12 कि इस लेवल के ऊपर डिमेंशिया होगा, इससे कम नहीं होगा? इज दैट पॉसिबल?
So, sir, there is a range which is provided by the lab, but even if it is low normal, people can have memory issues. So it's always best to maintain it at the upper limit of normal.
Upper limit.
And
Okay.
a good way is to just give injectable B12 because that will rapidly bring up the B12 level. And if the person rapidly improves or recovers completely, then obviously it was due to B12 deficiency. But if they don't, then one can look into Alzheimer's and other conditions. After doing a general examination, one does the cognitive assessment, and there are very detailed tests available for this, but it's difficult to do them in every patient for lack of time. So one very common test available is mini mental state examination, which is easy to perform. So this is the test where certain questions are asked from the patient and they are scored. So the total score is 30. And if the person has anywhere between 24 to 30, the score of 24 to 30, then that means they have mild issues. But if it's less than 24, then, it would be a bit more severe. So if one looks at the main degenerative dementias and Alzheimer's, mainly the memory is affected. In vascular dementia, that starts after a stroke and it will generally happen all of a sudden, the memory loss. And then the other less common types, there's one type which is associated with Parkinsonism. Parkinsonism typically involves slowness of movement, stiffness, sometimes tremor. And there's also another type in which there's a change in the behavior, which is the prominent issue. So there will be some mild memory problem, but the predominant problem will be a personality change or behavior change. The tests that need to be done, as I mentioned, the B12 level and the thyroid function, general lab tests. And if one is suspecting an infection in the body or a brain infection, then accordingly tests will have to be done. Brain infection always requires a spinal tap or a CSF examination. Usually EEG is not required, it's only needed in certain conditions. But if one doesn't pinpoint a simple cause for the memory loss, then practically everyone will need some form of brain imaging. And usually this is an MRI because CT can miss a lot of things. I'll come on to these blood tests a little later. So the MRI like if you see this normal healthy brain, this is a healthy brain of a slightly older person. So these black areas are called sulci. These are depressions on the brain surface and they're normally present. So these become a bit more prominent as one gets older because the brain tissue tends to shrink or the number of nerve cells go down. So the gaps between the brain cortex, they become more prominent. These sulci are prominent. So even this is not the brain of a younger person, it's the brain of an older person because these sulci are prominent. But if you notice the brain of an Alzheimer's disease patient, the shrinkage is much more compared to the healthy person. So these sulci are much more prominent. These are called ventricles, which are fluid-filled sacs within the brain. And if you notice, this ventricle is looking bigger than this one because the shrinkage here is more severe. So the fluid gets more space
मुझे
and
बता देना, मैं यही हूँ.
balloon up.
I'll just send a message to her.
Now, there's another type of dementia called frontotemporal dementia, and in that, certain parts of the brain may be more shrunken. So if you see here, the front part or the frontal lobe is more shrunken. here, this is the speech area of the brain. It's called the temporal lobe. And here, the sulci are much more prominent here than the rest of the brain. So certain parts are more shrunk than the others. This is the brain of a person with vascular dementia, meaning stroke-related dementia. So these white areas are areas of low circulation, and they may happen because of previous small uh, strokes in the brain, or it can be a more gradual thing where there can be silent strokes. The person may not get any symptoms of paralysis, etc., but gradually the circulation is going down. That is why all these white spots are present. Here is another type of vascular dementia in which you have small bleeds all over the. So again, they may not have paralysis or other such signs. It may just be a gradual memory loss. Sometimes one also does something called a PET scan in a person with a dementia, but that's not a common test. Now going on to the treatment. So mainly, as I mentioned earlier, the treatment available, of course, for the non-degenerative dementias, one treats as per the cause. You try and find the cause of the memory loss and give the specific treatment for that. But if it's a degenerative dementia because of shrinkage of the brain, of all those types, Alzheimer's is the only one which has specific medication available. So till now, there were only two classes of medicines available. They're both available as tablets. And generally, one would start these tablets one by one. They take about a month or so to have their full effect. In some people, they make a difference. Some people even improve. Some remain stable. Dementia, Alzheimer's, of course, gradually progresses, but the tablet may help to slow down the progression. And in some, they do not help at all. So on the whole, they're not very effective medicines. Lately, however, in the last 2-3 years, certain medicines have become available which are felt to be more effective than the existing treatment for Alzheimer's. So these are called anti-amyloid therapies. What happens in Alzheimer's is there is accumulation of a substance called amyloid in the brain, which gradually accumulates over time, and that tends to destroy the nerve cells. So they found that these particular medicines removed amyloid very effectively. And these are injectable medicines. There are a number of them have been tried. The previous medicines tended to have side effects. But in the last year or two, there are two injections available, which have been found to be effective also with fewer side effects. And they are in use. They have been in use in the West for about 2 or 3 years now, although not very widely, more in bigger hospitals. And what is interesting is that just last month they have become available in India also. And when these medicines were being developed, uh, it was felt that one needs to have a definite diagnosis of Alzheimer's before starting a person on these medicines, because they have their side effects. So if you just give them to anybody with cognitive impairment, you're also exposing them to side effects. So that led to more extensive research, and they found these certain biomarkers which have now helped to confirm the diagnosis of Alzheimer's. Earlier, our diagnosis was based on the history, on examination, on finding a more or less normal MRI. Other than shrinkage of the brain, there was nothing else. And more on ruling out other causes of dementia. But now we actually have specific tests available which can give a confirmed diagnosis of Alzheimer's. So some of these are some type of scan called a amyloid scan or a tau scan. These are not available in India. Amyloid scan is there in NIMHANS, but otherwise it's not available. There were also some biomarkers which were available on CSF examination. They are available in a few labs in India, but not widely. But the exciting thing is that now we have a blood biomarker, which is being done by a few labs in our country. And this is the one that is done. It's a easy to do test and it gives you a confirmed diagnosis. So if it comes positive, then you can say for sure that the person has Alzheimer's. And if they have a confirmed diagnosis, then one can offer these anti-amyloid therapies to the patients. The problem with these therapies are that they have to be given injectable once a month for donanemab and once in 2 weeks with lecanemab. This one is for a total of 1.5 years. This one, we don't have a definite time period yet, and they're expensive. They also put one at a risk for some side effects like swelling or bleeding in the brain. But with the current dosing that we have devised, these risks are low. And if a person has slightly more bleeding or swelling in the brain, one can always stop the medication and the problem will gradually reverse. So, I mean, these are things that can be offered. The cost is the major issue. So, so far in India, as far as I know, there's only one person who's had it so far, and only the first dose. So let's hope that the person does well. Other than treating the memory loss, many of these people will have psychotic symptoms, meaning they may get agitated, aggressive, it may be difficult to control them. And you may need psychiatric medication to control those symptoms. And some of them will also be depressed, so antidepressants may be needed. And of course, the other coexisting illnesses have to be managed because unless you manage these risk factors, the cognition will only worsen. Secondly, these are major risk factors for strokes. And stroke is probably even more or almost as common as Alzheimer's. So, if the person is predisposed to strokes, it will only reduce their brain reserves further. Many Alzheimer's patients will suddenly worsen. And that is not because of Alzheimer's per se. It's usually because of a secondary infection, something as simple as a urine infection or a chest infection, or it could be low sodium. So if there's a rapid worsening, one needs to look for these causes. Or for example, if they've had a minor head injury or a fall, it may be something like a bleeding on the surface of the brain called a subdural hematoma. And these are all easily correctable things. So if those are corrected, the person can come back to their baseline levels. Now, apart from the medication, very important is the non-pharmacological treatment, which is treatment other than medicines. So it has been seen that Mediterranean diet is said to be the best diet for preventing Alzheimer's, for preventing strokes. This is said to be the most healthy diet. So this involves more of fruit, vegetables, pulses, cereals, and yes, and fish in non-vegetarian.
Seafood.
Seafood, yes. Yeah. So this is said to be the most healthy. Physical exercise is important. Physical and mental exercise both help. So any form of exercise, even just regular walking, whatever the person is capable of doing, that helps. Mental stimulation, involving them in hobbies or activities which they enjoy doing. All that is stimulation for the brain. So that makes a difference. If the person is totally socially isolated, no contact with their family members or with with friends, that worsens their cognition further. It's not just the depression that happens with social isolation. It's also the lack of mental stimulation. So such people are found to have much worse cognition than those who have a good family support. Because people with Alzheimer's or with memory issues often have balance problems also. Or they may be, because of cognitive issues, they may not be able to take care of their own safety. For example, somebody may just go to the kitchen and leave the burner on. So there can be safety issues. So these need to be looked into. One needs to make sure that there's some caregiver who's able to supervise such issues and make sure that the person is safe at home. In the mild stage, when cognitive issues are just starting, it's good to have uh, an approach where one plans for the future. So financial planning could be done. The person may also, these are more common in the West, but this is something that is with educated people in India. These are things that people are looking into. So many people give advance directives where they may put it in written that if they become sick, they don't want to be put on a ventilator, they don't want aggressive treatment. Those advanced directives can be given by the person in the initial stages when they haven't progressed to a complete memory loss. And then those directives have to be respected. The caregiver can have a lot of strain put on them. It's very difficult to look after an Alzheimer's patient. And when one is looking at the patient, it's important to also see what sort of support the caregiver needs. So try and assess what their burden is. If they're depressed, one can offer them counseling or sometimes medication. Educate them about the illness. Tell them that the patient's anger issues or agitation is not, a behavioral issue. It's part of the dementia. So they know that this is a part of the disease and they can accept it better. Also, there are. I mean, it's much more in the West, but even in our country, there are support groups available, and one can always direct the caregiver to join those support groups because it helps to uh, talk to other people in the same situation and take cues from them. And also, one should encourage them to have some respite time where another person could look after the person, to look after the dementia patient for some time so that the caregiver gets some rest in
Very
between.
nice. Very nice. Thank you.
And lastly, I will talk about prevention for dementia. So this is a nice slide given by a Japanese journal, and they've divided the preventable risk factors to uh, various stages of life. So in early life, a good education can prevent further onset of dementia. In midlife, having regular physical exercise, managing your diabetes, hypertension, high cholesterol, these things help. Then treating depression, generally having a healthy lifestyle, so no smoking, avoiding excessive alcohol, and keeping a good weight and avoiding obesity. All these things help. Head injury can also predispose. So, well, it's not always that one can avoid a head injury. And hearing loss, treating hearing loss also helps because a person with severe hearing impairment is more deprived of, they have sensory deprivation. They're not getting enough mental stimulation, and that only worsens their cognition. And in late life, untreated visual loss, social isolation is an important factor. So make sure that such people have enough stimulation from their friends and family members. And interestingly, air pollution has been found to be a important risk factor also.
Wow. Wow.
Yes. That was new for me as well. So these are the things that can be done to try and prevent dementia.
Very nice.
So,
Thank you. Could you stop sharing, Dr. Charu?
yes.
Then I'll pin you on the screen. शेयर करना बंद कर दीजिए.
Thank you.
Now close the computer. Yeah, that's right. Okay. Thank you very much, because it's इतना बड़ा topic है, to reduce it into a few slides is not easy, and thank you for the effort. Now, there are already people who are giving questions. Dr. Mudgal sentence, and thank you, Mr. Batra. And I must share with you, Dr. Gaba, that at this moment we have Dr. Subir Majumdar from New York, 5:30 in the morning. We have Dr. IPS Kalra from New York at 5:30 in the morning. We have Mr. Ranjit Singh from Canada, and we have all over people from Bangalore and Chennai who wanted to attend this session. Now,
I'm very grateful that people to
no,
come.
not grateful. It is so important, and we have our special guest Natasha Kuller, who's a counselor at Medanta Hospital, an experienced counselor. So now, before I open the chapter, a lot of people want to ask questions. आपसे ये पूछना है, is memory loss going to happen to every elder? My first question.
As I mentioned earlier, so there is some slowness in the thinking that happens as one gets older. But no, dementia would not happen in everybody.
Everybody. That's important.
Yes.
और ये याद रखिए सब जो लोग सुन रहे हैं, सठियाना पुरानी पंजाबी में कहावत है, 17 बहत्तरा गया. It is not mandatory कि हर एक को डिमेंशिया होगा. Mild loss is possible, and that mild memory loss will not affect your life. That is the main difference. जब वो यादाश्त लोग कहना शुरू कर दें,
हटा दो
then it becomes a problem. Then it becomes a problem. So I think Surinder Singh, ma'am, you wanted to ask anything. I'll like to, or Batra ji, you wanted to ask something. Yes.
Yeah, I can ask.
Yeah, please go ahead.
Yeah, Dr. Charu, thank you very much for a very lucid talk. In fact, it was so technical, we missed some of the term, but still we could get most of it. Now, we have been hearing of this, that this is a very, very rare disease, and it comes only to people who from genetics or some family history. I think today you told us that no, even nutritional deficiency, even the B12 and sodium and all that can cause. Is it so? And you told that 8.8 million people are suffering out of that. That means every sixth person out of our people in elderly, they are likely to have this. So how do we know at one point that you have started having excessive loss of memory and you must visit Dr. Charugava?
So it's only when it starts affecting your activities that, I mean, when the person starts feeling that the memory issue is affecting their daily activities, that is the time to at least do the initial tests.
I'll interject here, Batra ji. बहुत छोटी छोटी बातें होती हैं. आपने सही सवाल पूछा. यही सवाल सब एल्डर्स के दिमाग में होगा. मुझे कैसे पता लगेगा कि मुझे मेमोरी लॉस है? आपको ना कोई घंटी नहीं बजेगी आपके अंदर. बहुत बारीकी से शुरू होता है. आपने पैसे दिए, यार मैंने पैसे दिए कि नहीं दिए. अगर आपको 2 सेकंड या 2 मिनट के बाद में याद आ जाए, हाँ हाँ मैंने पैसे दिए थे, डॉक्टर गाबा, दैट वुड नॉट बी कॉल्ड ए डिजीज. दैट इज माइल्ड कॉग्निटिव इम्पेयरमेंट, जो उम्र. अगर आपको याद ही ना आए, then that is going to affect your life, क्योंकि you will go and make a payment again to somebody. So जो इतनी बारीकी नहीं है, साफ पता लग जाता है कि इनको ये हो रहा है. बट आई थिंक डॉक्टर गाबा, आई लाइक यू टू टेल मी, मैं एक स्टेटमेंट दे रहा हूं. 90% टाइम्स और मोस्ट ऑफ द टाइम्स जिसको मेमोरी लॉस की शिकायत है, बीमारी वाली, उसको खुद नहीं पता चलेगा, लोग उसको बताएंगे. इज दैट अ करेक्ट स्टेटमेंट?
That's correct to some extent, sir, but sometimes the insight is there even in the person. Yeah.
See?
Sometimes
Batra
they
ji,
do know that they've become forgetful.
so घंटी जरूर बज सकती है.
No, I understand, sir. What I want to know, see, even if you are dealing with the younger generation at this time, you feel half of Elmiser you've got it.
वो तो by
You
choice
can't.
है. वो तो by
I
choice
think
है.
that if it starts bothering you,
Then
if
it's
you feel that you're forgetting enough for it to start bothering you, that is the time.
No,
there
that
is a question
cognitive
in,
capability.
Something, yes.
there is a question in the chat box. Any role of meditation in yoga? I think this doesn't need to be explained. It is there 100%.
Yes.
Dr. Mudgal is just thanking you and saying uh, blood-brain barrier vegetarian omega-3 with phospholipids is being recommended. Omega-3 with phospholipids is being recommended. What is your view on that, Dr. Kama?
There's no, we don't have trials for it.
Trials for
It's
that.
thought that omega-3 helps memory, and it's present more in fish, walnuts, and all. So no harm in including that in the diet. But there's no trials that are done, so it's not something we can say.
Jaypali from Bangalore says, is Alzheimer treatable at all? If a senior gets it, then the effects of treatment, are they worth it? Is it treatable at all? That's her question.
So it's not, there's no complete cure, but every person is different. There are people who would improve with treatment. There may be some who remain stable and function normally for the entire
And
life.
Dr. Mittal is asking, forgetting names of the person you know well, आप किसी को अच्छी तरह जानते हो, is it dementia? How do you improve upon it?
I think that is a common thing which happens with people. And it may also be because as you get older, there's also a bigger number of people you've met in life. So, the tendency to forget names may be there. But if it's something that's happening consistently, it's becoming embarrassing because you're forgetting names of very familiar people, then obviously it's an issue.
और अक्सर ये देखा जाता है, Dr. Gaba, that I remember my birthday straight away, or I'll remember somebody's birthday. But if I remember, I have to remember, whether when did I meet him last? There are certain things that are easily remembered, and there are certain things that are difficultly remembered. इसमें क्या difference होता है?
Different parts of the brain control different
Control
things.
different.
So, yeah.
So
There
आपके
may be something.
जो आपके वो मेन बोर्ड पे बिजली की स्विचें लगी होती है ना, तो वो एक आपने घटिया क्वालिटी की लगा ली, एक अच्छी क्वालिटी की लगा ली. तो जो घटिया क्वालिटी की स्विच लगाई है उसकी तार जल्दी जल जाएगी, तो जो कमरे में वो बिजली देके जा रहा है वहां की बिजली चली जाएगी. So brain is also the same.
Yes.
How can we? Yes, Ramji Singh ji, very nice to have you over. How do you prevent dementia? Just
So
two words again. Yes.
my last slide said that in early stages of life, having a good education is one type of prevention. And in general, having a healthy lifestyle protects against a number of diseases, including dementia. So good diet, exercise, treating your diabetes, BP, cholesterol, not smoking.
And I think Dr. Gaba ने सबसे पहले एक लाइन बताई थी. अभी आप सब चाहे 70 साल के हैं तो भी यंग हैं, क्योंकि मैं अपने लिए भी यही कहूंगा. बट व्हाट इज इम्पोर्टेंट इज प्लीज रिमेंबर कि आपको वेस्कुलर या एल्जाइमर टाइप ऑफ डिजेनरेशन होने के चांस है. सो बी केयरफुल. बी ये मैं कहूं कि हाँ मुझे चांस है, तो जैसे उन्होंने कहा प्रिवेंशन, प्रिवेंशन का सबसे पहला असूल होता है नॉलेज. सो इफ यू आर अवेयर, तो आप जाके डॉक्टर गाबा से डिस्कस करिए कि जी मुझे टेस्ट कर लीजिए. उन्होंने बताया एक फॉर्म होता है, मिनी मेंटल एग्जामिनेशन, तो वो करके उन्होंने कहा ठीक है अगले साल फिर आइए एग्जाम. बट प्लीज, बिकॉज दिस इज नो ब्लड टेस्ट, कोई एक्सरे सीटी स्कैन से नहीं पता चलेगा. It is purely by discussion with the neurologist. Long question, who is this iPhone? Memory decline is not destiny. Memory is vulnerable in old age. Okay, that's just a comment. Natasha, could you unmute yourself?
डॉक्टर आपने hearing loss के बारे में कुछ कहा था, which I missed it. How is the
Yes.
risk factor?
Yes.
So severe hearing loss adds to the disability. Already, if there are memory issues and the person has hearing loss, their stimulation from the external environment is less. So that
इसी और
only makes
ये
sense.
जो हियरिंग लॉस होती है, ये टेलीविजन सुनने की या फोन सुनने से नहीं। एक हियरिंग लॉस होती है कि आप बैठे यहाँ पे, आपके सराउंडिंग चीजें भी आपको सुनाई देती हैं, वो कम हो जाती हैं, देयरफॉर योर रिलेशनशिप विद योर सराउंडिंग इफेक्ट हो जाता है. दैट्स इंपॉर्टेंट. So I think Dr. Gaba has explained very beautifully that memory loss is not mandatory, but it happens. When it happens, it can be slowed down. I think that would be enough to say that. Natasha, could you please unmute yourself and show your ma'am, Surinder Singh ma'am, do you want to ask anything? आपने हाथ रेस किया हुआ है. She's a very old physiology professor from Lydia. I mean, a very senior professor of ours. And she's finding it difficult to. Anyway, I'll speak to her later on. So next, so I think memory loss की बातें बहुत होती हैं, डरना नहीं. Be aware that it can happen. And today we've had a talk by Dr. Gaba on the science of it. फिर साइंस के बाद इसका एक सोशल एस्पेक्ट होता है. So next week we propose, Dr. Gaba, I want to have Natasha. I don't know why she's not unmuting herself. Well, anyway, so I'll next week we'll have the socially dementia के patients को आप कैसे deal कर सकते हैं. That is important for individuals and if you have somebody. So we will have this topic by Natasha Kuller. She's a trained counselor and a PhD in counseling and is working as in the Medanta Hospital. We'll have her next week. But before we go,
Doctor, one question, please.
Please go ahead. Go ahead.
Sir, my just point is that is physical imbalance and stammering essential
Sorry,
part of
sorry.
dementia?
Sorry, दोबारा बोलो.
The physical imbalance for while walking and stammering little bit. Does that form the part of dementia along with this, or is it separately altogether?
It's not a part of Alzheimer's, but there may be other illnesses which can cause memory loss as well as imbalance, or it may be completely separate.
Maybe separate.
That is entirely, there's nothing to do with the dementia as such, or Alzheimer as such. That's a separate treatment to be taken.
That is separate. That is separate.
Okay, thank you.
Thank you. Ramji Singh ji, thank you.
I had a question, Dr. GREWAL,
Please go ahead. Please
from
go
Dr.
ahead.
Gau. I just wanted to know whether the oral medications like donepezil, memantine, are they started during the MCI stage, or do they have to be started only when dementia becomes visible? Because there is a very fine line.
Yeah, the approval for donepezil, etc., is for moderate to severe and for memantine for severe. But there's really no harm in starting them in the mild state. Because they have very few side effects.
Right. Thank you.
I think it's a pleasure to have Dr. Gaba over with us. And may I please request all of you to give a big hand to Dr. Gaba. And I must tell you, Dr. Gaba, we have a young lady called Dr. Pushpa Chandra.
Yes.
Dr. Pushpa Chandra, can you please unmute yourself? I want to bring you on. Unmute yourself, Dr. Chandra. कहाँ पे हैं आप? Dr. Gaba, she is one of the mothers of mothers gynecologists of Delhi.
I've heard she's very well known. Yes.
Yeah, she's She's unable to unmute herself. Anyway, so thank you
तो मैं
everybody.
तुझे कहूँ मैं सर
Hanji, before we say goodbye to Dr. Gaba, we have the youngest member in our company. He is Mr. J.S. Marwa. He is 25 years old with 50 years of experience.
डॉक्टर साहब सबसे पहले तो डॉक्टर गाबा को मैं एक कॉम्प्लीमेंट दूंगा बड़े बड़े दिनों बाद मैडम आपको सुनने के लिए 137 persons are available 137 it's a record
I
दूसरी
think
मैडम
also because it's a very common thing, forgetfulness.
दूसरी बात मैम आपकी बातें सुनते सुनते लोगों का मेमोरी लॉस हो रहा होगा जरूर पर मेरा मेमोरी इंक्रीज हो गया वो कैसे हो गया मैं बताता हूँ ये डॉक्टर साहब के लिए है डॉक्टर ग्रेवाल के लिए जो कह रहे 17 गए हैं जी अब मैं इनको बताता हूँ कि मेरे को इनके साथ कितना प्यार है और वो कितने साल पहले भी था आज वो क्या था 100 साल पहले मुझे तुमसे प्यार था मुझे तुमसे प्यार था आज भी है और कल भी रहेगा सदियों से तुमसे मिलने जिया बेकरार था जिया बेकरार था आज भी है और कल भी रहेगा
धन्यवाद 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 धन्यवाद.
Excuse me, Dr. Gaba. What are the
जी.
cost of the new? I'm Dr. Savita.
Yes, ma'am. So the cost of the new medication you're
Yes,
asking? So donanemab costs about 1.6 lakhs per month, and it's to be given for 18 months. So roughly around 32 lakhs is the total cost.
Thank
But
you.
the dosage keeps increasing every month because first it's 350, then it becomes 700, then 1050, then stabilizes on 1400. So ultimately, you would be needing 4 vials per month after the first, I think, 4 months.
And this is injectable?
It's injectable as an infusion, IV.
Infusion. Okay.
Thank you very much, Dr. Gaba.
Okay. Right.
And it was a very informative lecture. Thank you.
Thank you. Let's give her a big hand. Thank you so much, Dr. Kava. So nice.
Thank
And
you.
before she goes, we must say goodbye to her in the same language that we welcomed her. So all of you unmute yourself and say loudly, Mera
मेरा
swas,
स्वास्थ्य
mere
मेरे
swas,
पास मेरे हाथ
मेरा स्वास्थ्य मेरे हाथ
mera swas.
मेरे हाथ मेरा स्वास्थ्य मेरे हाथ
Thank you. Thank you. Thank you, Dr. Raj Kapoor.
Thank you.
Dr. Raj Kapoor, you're looking great.
Thank you, Doctor Saab.
Thank you.
Thank you so much. Thank you.
Informative talk. Thank you so much.
Thank you. Thank you, Mr. Tandon. Thank you.
Thank you. Thank you so much.